today announced the appointment of Dawn Bitz as Chief Executive Officer, an experienced global leader in medical technology, respiratory care, and digital health. Today's an opportunity for you to meet the market, our valued Adherium investors and supporters, and for them to get some insight into your vision for the company too. So let's kick off. Can you provide some insight into your extensive experience in the respiratory health sector to start?
So, I've been in the medical industry for the better part of almost 30 years now. And early in my career, I actually started off working as a paramedic on the ambulance and had my very first experience with patients who had respiratory problems, actually treating them at the bedside. That has translated into a career that has spanned that duration of time. I've had an opportunity to be in cardiovascular, but really the last 18 years, I've really spent the bulk of that time in respiratory and critical care medicine. It is where my passion is. Again, hearkening back to that time when I was actually on the ambulance treating those patients, actually invested in their outcomes. And continues to fuel my passion for where I am today. And it helps inform why I'm so excited about being here at Adherium and taking on this very important role.
Wonderful. I know we're very happy to have you. I think it's also worth noting your commercial experience. You've managed global P&Ls of up to $500 million US, major M&A transactions under your belt too. You've secured substantial funding through a variety of pathways, which is a real art and skill. Can you take a moment to colour this in for our viewers? Take us through your experience in developing, launching, and specifically scaling medtech products in market.
Sure. I've had an opportunity again to be with very large organizations, the kind of Boston Scientifics of the world, where I really felt like I grew up in those organizations and really had an opportunity to understand how very large companies worked, like Covidien Medtronic, also Vyaire, where I had again very extensive P&L responsibility. But about the last 9 or so years, I made the transition into smaller, earlier stage companies because I think it's one thing to have that very large company device medical experience and really seeing how they worked and launching products kind of to your point and bringing products to market with, again, very talented teams, building those teams underneath those infrastructures, and having that global footprint really to understand what it takes to really bring a product not only to a U.S. market, but also to markets all across the world. But again, as I said earlier, about 9 years ago, I made that transition to earlier stage, smaller companies, really where you get a chance to truly be innovative and drive innovation, not just in the products themselves, but also in how we bring those to market from a commercial standpoint. And as you had mentioned, that had the opportunity to introduce new products, scale those products, and have really been able to bring those products to millions of patients across the world, and drive those innovations and to see the impact. And like I said earlier, it's been really predominantly focused over the last roughly 18 years in the respiratory and critical care space, where you see that impact that those products and the technologies can have on the patients themselves and their providers.
Fantastic. Well, you're certainly going to be making some impact with Adherium, that I can see. Why Adherium and why now, though? This is an interesting challenge for you, and I'm curious to get under the hood there.
I think Adherium is the perfect opportunity for a product and especially a respiratory monitoring product in today's age. So when I look at number one, the breadth of product offering that Adherium has, you really think about it really covers about 100% of COPD patients and about 80% of asthma patients. And when you think about the impact of that, in the US alone, about 40 million patients really suffer from respiratory disease, specifically COPD and asthma. And a lot of them are chronic patients. They have they live with this disease and impacts their family members and their friends. And you're literally talking about, billions of lives that these respiratory diseases can impact. So when you've got a company like Adherium and the Haley product offering and really how diverse it spans and that breadth of offering, that's kind of number one. Number two, when you look at really the extensive learnings that the company has undertaken, and that's really informed and advanced the commercial strategy that Adherium has today, it's such an important and impactful inflection point today. Thinking about, again, two of the major contracts that Adherium has, anything from Intermountain Health and Allergy Partners, and the just, again, immense amount of patients and providers that those contracts impact. We're talking about, a roughly half a million, patients, as well as then, 500 plus hospital and provider clinics that can have access to this technology today as a part of that strategy, and all the learnings that have come from the ability to execute against it. And really, finally, when you think about kind of the cultivated environment in respiratory patient monitoring today, again, thinking about respiratory monitoring and how much kind of a desert there has been in the ability to monitor these patients. Diabetes is monitored today, cardiovascular, these are all standards of care, and yet we don't do it extensively for these respiratory patients. And yet, COPD and asthma are, in so many ways, the exacerbations of those can be oftentimes prevented by really good monitoring and kind of early intervention as the patient is starting to have more of a trajectory that's declining over time. We could prevent a lot of those exacerbations and ultimately save, millions, if not up to hundreds of billions of dollars in healthcare costs just by overseeing those patients in a more kind of meaningful way.
Absolutely. I think the power of this technology is to do exactly that. So look, Dawn, it's wonderful to see such a dynamic new leader at the helm of Adherium. The time really is now to see this technology shine, make such a vast human impact. What are you most excited about as you embrace this role?
So first of all, the team. I really embraced the people and a passion for respiratory care, and really cultivating that passion within the people, within the team of Adherium. Because again, in so many ways, it starts with the team here at Adherium to be able to make that clinical strategy happen, to affect all of those patients, all of those providers, the patient advocates, the KOLs, everybody in this entire environment in the respiratory care. We also have, again, I think, amazing investors, and the integrity of those investors, and making sure we maintain that integrity, and also building trust within the patients and the providers themselves. I think those are three really important pieces that, for me, are such an important impact in not only what we can do at Adherium, but also how I can help drive and cultivate that leadership. And really, in so many ways, collaboration at our team level, collaboration with our investors, collaboration with our providers, our KOLs, and of course, then with the patients and patient families.
Wonderful challenge ahead for you, Dawn. Look, thank you for taking the time to meet us on the line today. It's a great pleasure to get to know you and to learn about your vision for Adherium. For those eager to learn more, you can, of course, visit the website at adherium.com or follow along on the ASX via ticker code ADR. Dawn, thank you so much. We're looking forward to see you warm up into the role.
Very excited to begin this journey with Adherium and be able to navigate what is in state for not only the company, but again, all of the people that are affected, the patients themselves, the families. And again, we can affect 1 billion lives in this way.